Welcome back. Landmark Health is a local medical group bringing back the house call. Their team of specialists go to patients' homes to help them avoid trips to the emergency room. Joining us now is Landmark Community Health Advocate Ashley Menke and Landmark patient David Lancaster. Welcome.
Hi, thank you for having us.
Of course. So Ashley, this first question's for you then. Tell us a little bit more about Landmark Health, what you do.
So Landmark is a special medical group that provides house calls and urgent visits for our members, and so that we can take care of them in the home. So it's a little different than your traditional healthcare group.
Right. And then tell us, why is it important to help patients avoid the ER?
So we work with them to try to be proactive and help them manage their conditions so that they can avoid unnecessary emergency room visits.
I see. But that still is a part of it sometimes, and that's the reality,
absolutely,
right?
yeah, and that we will help them understand when is a good time to have Landmark home assist them, and also when it's appropriate to go to the emergency room.
Wonderful. Okay, and David, tell us about your experience with Landmark Health.
It was a wonderful experience with me being totally blind, just knowing that I can have somebody that can show. You know, having a doctor, having a nurse practitioner come out. Nurse practitioners can do everything that a doctor can do, and except surgery. So it's always good to have them. And you know, if you ever try to call your doctor, you realize that you're never going to get to talk to them. But when they're out there, they communicate with your doctor or your physician, and they get calls back. So I've had nothing but great experiences with them.
Wonderful. So, and it seems to me that this is a true extension of the family unit. I mean, do you get to know these people very well that you're working so directly with?
Well, the thing is about Landmark is there's a word that we don't use. It's called empathy. They understand what we're going through as a patient, and so it's more than a family. You don't argue with them.
You know that they're really on your team.
They're coming. If they say they're going to come, they're coming. You know,
right.
Your family members might not. So.
Well, hopefully they do, though.
Yeah.
We're hoping. Okay. Well, so do you find relief in knowing you can call Landmark at any time, any day? I mean, it sounds like they're available 24 hours, 7 days a week for your needs.
Yes, they are, and I try to be a jokester, so one night I woke up at 2 o'clock in the morning and I hit my button, and they responded within 3 minutes.
Wow.
You know, and I had to tell them, oh, I accidentally rolled over on it, but they were ready. I've had an emergency where I had them where I couldn't even walk. I had to crawl to the door to open the door. Oh, goodness. I was having migraines, and being disabled while not being able to see. The anxiety that you have when you go to an emergency room, you know, having that comfort zone in your own home that somebody's going to come out and make sure you're okay, and then they follow up after that. So
that's wonderful. See, that's I think what really gets me. I mean, you go in, you have some ailment or something, and then there's no follow up, and it's like, well, am I okay still, or what's the next step from here? So that's good to know. Landmark does follow up.
And the whole staff, that when I call, they're all helpful. They're just friendly. Right. And like I said, they have that key word is empathy. They understand that you're having a bad day. So and the promptness. Right. And the teamwork that goes in. If your nurse is not there, the other nurse is there. There's always somebody there for you.
Sure. And you mentioned pushing a button. Is this the Landmark Link call button that you were referring to earlier?
It's the Landmark Link button, and it comes with the charger. And what I like about it is being on a fixed income, and Landmark pays for it. You know, that's a little more money in my pocket, so I don't have to pay one of the other services to be able to be in contact with a health link or whatever it's called. Right. So that's always comforting too.
Sure. So. And so Ashley, how do you find out if you qualify for Landmark services?
So it is a service that's offered through a person's insurance company. And if you go to our website, you can check your eligibility status on our website.
Wonderful. Okay. And then what's it like being a caregiver? We'll kind of turn the tables on you a bit.
So it's very rewarding. There's so much value in being able to go to someone's home in that environment where you can speak with them and take your time. You know, we're there for up to an hour when we do these visits, and so we can really get behind what are some of the background issues that might be impeding their overall health, and what are some of the barriers, and then we can follow up with that by going to other team members like social workers and behavioral health therapists that are also available to assist them with those problems.
Okay, wonderful. Thank you both for being here.
Thank you.
So to learn more about Landmark Health, you can visit their website, landmarkhealth.org. You can give them a call or visit them at 1 Galleria Boulevard, Suite 1420 in Metairie. We'll be back. Good job, guys. Thank you.
Thank you, David. That was great.
Oh, no problem, no problem.